Hey, everybody, good morning. I need a round of applause to everybody in Chicago that's here, right? That's fabulous. Thank you. So for those that don't know me, my name is Stuart Schlossman. I'm president and founder of MS Views and News. Though this is not an MS Views and News program. This is a Yoga Moves MS program. And that's Mindy Eisenberg over there on the right, my right, your left. And she is the one that is responsible for wanting to do this event in this area for today. I want to thank our sponsors and our exhibitors. So giving you the name of our sponsors, we have TG Therapeutics, Biogen, Bristol Myers Squibb, EMD Serono, Horizon Pharmaceuticals, Novartis, Alexion, Genentech, Amneal, who's a new company that most of you have not heard about yet, and Banner Life Sciences. So let's give them a round of applause for supporting this event. Fabulous. All right, so our next presenter is Allison Block. And Allison is a multiple sclerosis fellow at the University of Chicago. Her presentation is How Inside and Outside Environment Affect Multiple Sclerosis. This is going to be extremely interesting to listen to. Allison Block is a DO, is a multiple sclerosis fellow at the University of Chicago. She went to medical school at Moines University. She recently completed her neurology residency at the Medical College of Wisconsin in Milwaukee. She's currently doing a clinical fellowship in multiple sclerosis at the University of Chicago. Dr. Block also has a special interest in a mimicker of MS called anti-MOG associated disease. I've heard of that. Thank you. All right, next year, she will be practicing with Edward Elmhurst in Naperville, where she lives with her spouse and toddler. And let's welcome Allison.
Thank you.
Thank you.
All right, thank you so much for that great introduction. And again, I'm Allison Block, and I'm a neurologist doing some extra training in multiple sclerosis at the University of Chicago. Very honored to be here. So as was briefly discussed, I'm going to be talking about some environmental factors that may impact MS, both with regards to development of MS, so risk factors for developing MS, and talking a little bit about how various risk factors may have an impact on one's MS course. So I'll start with a brief outline. Again, we're looking at various factors that can impact MS. I'm going to talk a bit about the gut microbiome, Epstein-Barr virus, obesity, tobacco use, vitamin D, a little bit of research on organic solvents, and shift work. So we'll start out with the gut microbiome. So what is the gut microbiome? So these are all of the microorganisms that live in our gastrointestinal tract. This has been a hot area of research over the past 10, 20 years, including within the realm of MS. We know that the gut microbiome has manifestations throughout the body, and it can influence systemic inflammation. And MS is a state of heightened inflammation. It's a pro-inflammatory state. So recent research has discovered that people who are facing MS have a different microbiome than people who don't have MS. Very recent research, just published in the last month, has discovered that there's a new bacteria found to be elevated in people with MS in a higher proportion than people who don't have MS. The bacteria has been known for a very long time, but it's just been found that this is elevated in people with MS. It's called Clostridium perfringens, and this bacteria can produce a toxin known as the epsilon toxin. Now, when this group looked at Clostridium perfringens, they found that compared to people who don't have MS, people who do have MS have about double the amount of Clostridium perfringens in their gut on average. But then to take this a step further, they looked at how much of this epsilon toxin was present in people who had MS compared to people who don't have MS. And they found that there was thousands-fold more amounts of this epsilon toxin in people facing MS than people who don't have MS. So they started to ponder, well, how does this impact MS? This seems very significant, so how could this be involved? Well, when we're studying MS, typically we use an animal model to try to replicate MS in a more ethical way. And so MS is induced in mice with something called experimental autoimmune encephalomyelitis. Now, it's not a perfect model of MS in the humans, but it's kind of the best model we have right now. There are various ways to induce EAE in mice, and one of the means is to give the mice a toxin that breaks down the secure barrier between the blood and the brain. And so this group, rather than using a typical toxin that's used, like the pertussis toxin, they try to use this toxin associated with Clostridium perfringens, the epsilon toxin, to build a model of MS. And they found that this new mouse model of MS, actually reflects MS in humans better than any other model that has been looked at. So it seems like this is a very, very promising avenue for a new toxin that is probably related to the pathogenesis of MS. There's more research being conducted, and I think it's very promising that this can improve our understanding of the mechanisms of why MS occurs, and then further looking into whether this toxin continues to be involved in the course of MS, and ultimately, of course, with the hopes of influencing therapeutics for MS and finding a cure for MS. So we are very, very excited about this new research that's coming out of New York. So in terms of now, like, how do we take this information about the different gut microbiome in people who are facing MS and try to influence one's MS course? So unfortunately, there's not a lot of great research about specifics on how to influence the gut microbiome in MS, but our group at the University of Chicago advises people to eat yogurt, so a probiotic, and in general, trying to stick to something that's high in protein, like a Greek yogurt, and low in sugar. It was surprising to me when I was a teenager and started to look at drug labels how much sugar is in a lot of yogurt. So trying to find one that's a little bit lower in sugar is ideal. And then sometimes people also inquire about other supplements, other probiotic supplements. And again, we don't know specifics in terms of what is ideal to optimize the microbiome in MS, but we advise, if you're gonna take a probiotic supplement, to take one that has more than one microorganism in it. And then more research, hopefully, will continue to be done to figure out how to optimize that gut microbiome and probably individualize it too. Okay, so we will switch gears and talk a bit about the Epstein-Barr virus. This, as many of you probably know, has been a pretty hot topic in MS for a long time. What is the Epstein-Barr virus? So it's a herpes virus, and it's commonly acquired in childhood. If you get Epstein-Barr virus when you're a kid, usually you're asymptomatic. However, if you get it when you're an adolescent or later as an adult, you develop infectious mononucleosis, and you're symptomatic. Anyone who's ever had EBV has the EBV retained in their body. It lives in a subset of the immune cells, the B cells, and it remains latent. So it's not doing anything it may not be doing anything as far as we know, but we never get rid of the EBV. And we do know that everyone who has MS has EBV in their blood. We also know that when one acquires an EBV infection in adolescence or later, the risk of developing MS is higher than in people who develop EBV in childhood. Now, the mechanism of how EBV relates to the risk of developing MS and whether EBV continues to be involved in the pathogenesis of MS once one is facing MS is not well understood, but we know that EBV is very, very common. Over 95% of adults have EBV in their blood, and most of those people don't develop MS. So how is this related to MS? Well, we don't know for sure, but we're pretty confident that this is multifactorial. So genetics play a role in MS for many people, and we think that this is probably an interaction between the Epstein-Barr virus as well as genetics that may increase one's risk of developing MS. There's currently more research underway to better understand how EBV relates to the course of MS and whether this can be a target for therapies. There are some drug trials going on right now that target Epstein-Barr virus in the body. And then whether there could be some sort of way to use EBV to prevent MS. So people are talking about maybe vaccinating people for EBV when they're very young, but this is all stuff that we have to be very, very cautious with, and we need to understand more about. Okay, so next we're going to talk a bit about obesity. So I want to reiterate what's kind of been discussed a lot throughout the morning and this afternoon, that multiple sclerosis is an autoimmune disease where the inflammatory system is overactive. Our immune system is overactive. So one thing that we know about obesity in general is that it promotes inflammation. Pro-inflammatory mediators are produced in the fat tissue, and then beyond being pro-inflammatory, obesity has other detrimental effects. One of the many includes impacting our ability to use vitamin D. It makes vitamin D less available. So with regards to obesity and MS risk, we know that the adolescent years are very key, and this is going to be kind of a recurrent theme in my talk. So obesity in adolescence is associated with a twofold risk of developing MS. If one already has a predisposing genetic risk factor for developing MS, say they have someone in their family who has MS, and they're facing adolescent obesity, their risk of developing MS actually goes up by 14-fold. So we know that it's very, very important, those adolescent years, to try to maintain a healthy weight. With regards to obesity and the MS course, we know that people who have obesity, especially obesity that's in the abdomen, really heightens the risk of disability from MS. The risk goes up by about 50% to face severe disability from MS in people who have abdominal obesity compared to people who don't. So I think this topic really underscores the importance of diet and exercise, and our group has been really thankful at the University of Chicago to have been partnered with Dr. Model in helping provide education about his studies at the University of Illinois, because he's really world-renowned in his field, and we're really excited and thankful to have him in Chicago. I'm excited to see who we can recruit for his newer trials with regards to depression as well. And then also just underscoring the importance of a healthy diet. Okay, so we'll move along to tobacco use, and you're going to hear a lot of parallels with regards to tobacco use to what we discussed about obesity. Similar to obesity, we know that tobacco smoking is also pro-inflammatory. With regards to smoking and MS risk, smoking increases the risk of developing MS. This is both from active smoking and passive smoke inhalation, and the risks are cumulative. So the more exposure one faces, the higher the risk is of developing MS. With regards to smoking and the MS course, there are a lot of studies that suggest that one's rate of disability progression and symptom progression in MS are very increased at a great rate in people who smoke compared to people who don't smoke. So the rate of disability progression in people who smoke tobacco is 1.5 times to 2 times as fast and as severe as people who don't smoke. Now, otherwise, with regards to disease-modifying therapies, we know that at least with a few of the disease-modifying therapies, they seem to be less effective in people who smoke tobacco. Sometimes people on disease-modifying therapies develop antibodies that work against the disease-modifying therapy. We know that with regards to tobacco, this can be true with natalizumab, as well as with some of the interferons. So why is this the case? Well, the theory is that smoking and MS, smoking impacts MS in a negative way because of the inflammation in the lung that smoking tobacco propagates. We don't see the same risk in people who use oral tobacco like snuff. Snuff is actually protective against MS, surprisingly. We certainly don't advocate for snuff because it, of course, is associated with other risks such as cancer, but the theory is that the nicotine in the oral tobacco it's anti-inflammatory, and so perhaps that's why we see that decreased risk. So now we're going to talk a little bit about getting outside. We'll talk about vitamin D. So vitamin D is important. Everyone needs it. It promotes calcium absorption. It's needed for healthy bones. It also supports the immune system. We know that people who faced COVID did better if they had a more normal vitamin D level than people who had low vitamin D levels. We also know that in general, vitamin D decreases inflammation. With regards to vitamin D and MS risk, we know that people with low vitamin D have a higher risk of developing MS. We know that people who live further away from the equator at a more northern latitude, or if you're south of the equator, a more southern latitude, are at higher risk of developing MS, and this is thought to be related to UVB exposure and summer sun exposure in general, which are both involved in vitamin D production. So the risk seems to be most pronounced in one's risk of developing MS and vitamin D level, again, in the adolescent years. We know that people who immigrate from a country of low risk to a country of high risk during their childhood years actually will carry the risk of the high risk country despite living in a low risk country for part of their life if they immigrate before adolescent years. We know that some of the genes that are risk factors for developing MS are related to vitamin D regulation, and so that's part of the theory as to why vitamin D may play a role in making the MS course and risk for MS worse. So in terms of vitamin D and the MS course in people who are facing MS, the research unfortunately is a little bit less certain. There's been some mixed studies on this, but one good quality study showed that early in MS, low vitamin D levels is associated with more progression of disease, more relapses, and a higher risk of having disability down the line. I think that vitamin D is really important to take when you are facing MS, even though some of the data is a little bit more mixed. But I think we just need higher quality data and more rigorous studies in this realm. Our group recommends vitamin D supplementation to all of our patients who have MS, and we check blood levels periodically to make sure that people are at a good level. The target level in MS is greater than 40 nanograms per milliliter. Usually a lab's normal would be 30 or above, but in MS we target 40 or above. Now, it is possible to get vitamin D toxicity, but it's very, very rare. Usually this isn't seen at levels below 150, which is a really, really high level. I've never seen vitamin D toxicity before, but it does have the potential to cause kidney stones and bone loss. So that's why we kind of monitor the levels over time to make sure that we can optimize one's dose of vitamin D. So how can you get vitamin D? The best source is actually probably through the sun. So we recommend that people expose their limbs for maybe 15 minutes a day, wear sunscreen on your face, wear a hat, but try to get a little bit of sun exposure on your arms and legs every day if you can, because we know that vitamin D levels are optimized through UVB exposure. And then I think, but also being mindful of skin cancer risks, then thereafter putting on some sunscreen and making sure that you're watching your exposure as well. But we definitely recommend people spend some time outside in the sun every day if possible. With regards to food sources for vitamin D, there are a lot of foods that are rich in vitamin D. Oily fish like salmon and tuna, egg yolks, pork, and then many foods are fortified with vitamin D, for example, milk. Most of our patients living in this area, though, also have to take a pill to supplement their level and get it up to that goal. Almost everyone in the Chicagoland area has a low vitamin D level unless they're getting outside a lot or taking a supplement. So we recommend vitamin D3. The dosing is usually between 2,000 and sometimes up to 10,000 international units a day. But this is something we advise for all of our patients. Another carryover from this, I think, is if you are facing MS and you have children or grandchildren, I think it's probably important to advise that they try to get outside and maybe take a vitamin D supplement in their adolescent years to reduce their risk of MS. Their primary doctor should be able to monitor their level as well. So we'll move on to a topic with a little bit less research, but I think that is important to discuss. This is with regards to organic solvents. So what are organic solvents? So they're liquids that have something dissolved in them, and that something has carbon. Some examples of organic solvents include dry cleaning chemicals, paint thinner, nail polish remover, glue solvents, spot removers, and perfumes. So what do we know about organic solvents in MS? Well, some evidence has shown that organic solvents seem to be a risk factor for developing MS. This is thought to be possibly mediated by lung irritation and inflammation from frequent inhalation of these substances, and similar to tobacco use, which is thought to be, the risk is thought to be mediated by lung inflammation. So our group, what we kind of take from this research, because there's really no good research, unfortunately, yet about how organic solvents impact the course of MS. Basically, if one has a family history of MS, trying to avoid working in these conditions where you're exposed really regularly to organic solvents to reduce the risk of MS is something that we advise to our patients to reduce their relatives' risk of developing MS. We'll move along and discuss shift work. So there have been a few studies looking at shift work in MS out of Scandinavia, and basically, in these studies, shift work has been described as non-traditional working hours, mostly like the night shift, working before 7 a.m., working shifts after 9 p.m., and also working really inconsistent shifts, some nights, some days, moving all around. And so in people who partook in shift work before age 20, their risk of developing MS was increased by 70%. And then in people who were older than 20 who partook in shift work, their risk of developing MS was increased by 20%. Now, the theories as to why this may be included a few things. One, perhaps it's related to sleep. So sleep is really, really important for everyone, probably more important for people facing MS. So when you're working night shifts, your circadian rhythm is off, and it's harder to get good restful sleep when you're trying to sleep and the sun is out. And so I think what we can carry away from this is, one, if you have a relative and they're young, probably discourage them from doing shift work if possible. And two, it's really important to get good sleep when you are facing MS. That was all I had to say. Those are the risk factors and variables that can impact the course and risk of developing MS that I wanted to discuss. And I really am grateful to be here and happy to take questions.
Thank you for presenting.
Thanks for having me.
Awesome. Oh, I see questions. That's good. All the way to the back. And then we'll go online, okay? So Allison thought it was a great idea to increase the amount of time for questions, so that's what we did for her. Good idea.
Indeed.
How much over like the normal range of vitamin D do you recommend someone with MS to have?
Yeah, that's a great question. So if you get your vitamin D level drawn by a lab and it's above 30, the result will say you have a normal level. We want your level to be above 40. Usually we target somewhere between 40 and 100. If you get above 100, then we say, hey, probably stop taking your supplement or cut it back a little bit. Yeah.
Thank you.
You mentioned smoking tobacco and smokeless snuff. What about medical use of marijuana? Any recommendations there?
Oh, sure. Yeah. So there's some decent evidence with regards to medical marijuana out of the UK, specifically with regards to intranasal medical marijuana, that it can help with spasticity in MS. So that increased tone in your legs where your muscles feel really tight and it's generally quite painful. We know that can help with MS. There's some less good quality data that it can help with fatigue and other pain, neuropathic pain related to MS. It hasn't been very well studied in the US. It probably will start to be more and more well studied as it becomes legalized in more places. But our group recommends medical cannabis for a lot of our patients for help with pain, sleep, spasticity, many other things. I think you have to be a little bit careful with regards to how much THC you're taking in. So there's two components to medical cannabis, CBD and THC. THC is the component that can affect your cognition. So usually we advise that people try to get a ratio that has more CBD than THC, and then trying to minimize your dose to the lowest possible effective dose. But it's certainly something that I think can really help with symptom management.
Thank you. Great answer. Thank you.
Thanks, Allison. Did you do any cross-sectional studies that looked at how Clostridium improfundus affects the mobility, fatigue, and symptoms of MS?
Oh, that's an awesome question. So I'm just reviewing the literature. This was a group out of Cornell that just discovered this epsilon toxin in relation to MS, and there haven't been any studies looking at, as far as I know, because this is very, very new research. It just was published last month with regards to how this is impacting disease function and symptoms. But I think it's kind of groundbreaking research. I think there's going to be a lot more to come in this realm, because it seems 1,000-fold more toxin in people with MS. It seems pretty significant.
I have a quick question before I go to the next person. With regard to the CBD or the THC in marijuana, do you prefer that they use gummies over smoking?
I guess I'll make the point that I think it's really important to try to get this sourced from like a reputable carrier and not from the black market, because it can be laced sometimes if you get it from someone you don't know. But going to a dispensary, I think, is important. In Illinois, we're lucky to have a medical cannabis program where people can get discounts if they get clearance from their medical provider. But with regards, I'm sorry, now I'm losing my train of thought. What was the question?
The question is, smoking's bad for you, period.
Yeah.
So therefore, they should not be smoking medical cannabis.
Yeah, I think, I have many patients who do smoke medical cannabis, but I think the route of something oral or topical is better because you're less likely to promote lung inflammation.
Thank you.
Yeah, thanks.
Can you talk about probiotics and prebiotics, and what's the difference, and what would you suggest?
I don't know a lot about prebiotics, but with regards to probiotics, our group recommends eating Greek yogurt that's low in sugar. And then if you're going to take a supplement, a probiotic like pill supplement, take something that has more than one organism in it. And it's really unknown what the best combo is, and it's probably eventually going to be somewhat personalized to one's microbiome.
Okay, back here.
So a question about the vitamin D and the sunlight. Have you done a study as far as the people that live closer to the equator as opposed to people living on northern hemisphere as to how that affects their MS?
Well, that's a good question. So I personally haven't done a trial in that, but I know that there are a lot more people who get diagnosed with MS further north of the equator than those who live near the equator. We know that MS is a lot more common up here than, say, in Florida. And so one of the theories as to why that is because people who live near the equator probably naturally have a better vitamin D level than people who live up here. We don't get as much sun exposure.
I was wondering, this has been so informational. Is there some place to online follow your study results or this type of information? I already subscribe to a lot of the MS newsletters and I get things that way, but some of the things specifically that you're talking about are just so interesting. I'd like to follow it. Mainly, I have MS and I'm really worried about my children having MS. And so it's more, what are the preventative things you went through, the links?
Yeah, so again, none of this is my primary research. This is all kind of a summary of what we know about the major risk factors in the environment. But I think my favorite reputable website that I usually refer people to is the National MS Society. I think they're very comprehensive and very credible. So nmss.org is where I usually have people start, and they're pretty good about talking about breaking discoveries in MS and changes in recommendations. That would be my go-to.
I could also tell you that if you go to the MS Views and News YouTube channel, all of your answers are there.
In regards to the gut biome, can you comment on dairy? I've read a lot about MS. Patients should stay away from dairy. It's very inflammatory. Any thoughts on that?
Yeah, that's a good question. So we, I guess, don't recommend like a specific MS diet. There are a lot of things that we know, like try to avoid processed foods, try to avoid really salty foods, try to be high in produce and low in fat. But I mean, we actually recommend that people eat yogurt to help contribute to the gut microbiome, but I can't pretend to say that I know a lot about how dairy would influence inflammation in MS. I'm not sure. Thanks for the question.
Is there anywhere you can go to get information regarding CBD and what would be helpful for someone? I know we're not supposed to use but I find it very hard to find information to even like from the dispensaries to get like what kind of CBD would be good for certain things.
Yeah, that's a great question, and I can't say I have a great answer for that. I think usually I don't feel that I have a lot of expertise in that realm, except that I recommend people try to find a low THC, high CBD formulation, so more CBD, less THC, because it affects cognition less than. But with regards to targeting specific symptoms, at least for my patients, I think it ends up being a lot of trial and error. So working with a dispensary and trying something like a topical or gummies and trying to figure out what dose works for you. But again, lower THC, definitely we recommend that if possible.
And as far as a resource on that, the National Multiple Sclerosis Society definitely does have a lot of information on that, as does a Dr. Alan Bowling from Colorado, who is the leading MS doctor on complementary therapies in the United States and does a tremendous amount of research on medical cannabis. Dr. Alan Bowling.
Awesome.
B-O-W-L-I-N-G.
Thanks. Thank you for all this information. Have you run across any data on the use of hair dyes and developers as one of those organic solvents that might be, have a negative effect?
Yeah, that's a great question. So I think it will probably fall in the category of organic solvents. I don't know specific data about people who like work in the hairdressing industry, but I think that it's probably related to cumulative exposure. So trying to minimize the cumulative exposure to these things and if possible, it's not always possible, but, try to dissuade younger adolescents who carry a higher MS risk from working in a setting where they may have a lot of chemical exposure to these organic solvents. Yeah.
Great. Has intermittent fasting benefits been studied for people with MS?
Oh, yeah. So I can't say I'm familiar with research on intermittent fasting in MS. That's a great question. I'll have to look into it.
In regards to vitamin D production from the sunlight, does sunscreen diminish that effect?
Yeah, so it's going to reduce your UVB exposure, which is good to mitigate your risk of skin cancer, but I think it's striking a balance, wearing some sunscreen, but trying to get out in the sun. I think these things are important. So I don't go in the sun at all. I think be smart about going in the sun and wear a little bit of sunscreen. But yeah, it will reduce your UVB exposure. Thank you. All right, another person's asking, is hairspray a bad solvent to breathe in even occasionally? Yes, there's not... The data on this was more in relation to people who had like really, really high levels of exposure. They were working in settings where they were exposed to this throughout their shift. So I wouldn't try to micromanage your life so much that you're not using hairspray. I think it's more about settings of employment and really a lot of exposure to these organic solvents. Okay, thank you. Next one. Smoking is clearly bad for MS. What about smoking cannabis? I think we just answered that, though. Yeah, so I think inhaling and inhaling things like tobacco or these organic solvents seems to influence lung inflammation and seems to worsen the course of MS. So I think it's better to use cannabis from a different route than smoking if possible,
Okay, a couple of people are
in
asking.
theory.
I'm going to get to you in a moment. A couple of people are asking, for those that have multiple sclerosis and who have children, do you recommend that children start using vitamin D at an early age?
Yes, I think a few things that I tell everyone who has MS and has children or grandchildren or nieces, nephews. One, make sure that, especially in the adolescent years and in the childhood years, just to develop the habit that they get outside and spend some time in the sun. This definitely can be with sunscreen and probably should be, but get outside a lot. To also probably take a vitamin D supplement. You can, I think there's probably some lack of good knowledge dissemination against some or to some primary care doctors, but I think it's probably important that adolescents with a relative with MS probably take a vitamin D supplement too and have their level checked every so often. Otherwise, with regards to mitigating the risk to developing MS, avoiding adolescent obesity, avoiding smoking in the adolescent years, and exercise. Exercise is so important throughout one's MS course and in regards to just maintaining a healthy weight.
Question over here.
The Rise dispensary is the place that you need to get your answers for the cannabis. That's how I learned how to use it. And you
Okay.
have to talk to managers because just the everyday people that are selling it to you, they're not going to have the answers. That's how I learned.
Where is that located?
Rise dispensaries, there's Chicago, there's Naperville, they're all over the place, at least in Illinois.
Okay,
I
good to
think
know.
There's 5 of them.
Great, thank you. Appreciate the insight.
Dispensaries really, really help.
For those who are asking about CBD, I came from Colorado. I did my PhD over there, and I want to highlight something that was my dissertation. When you talk to the managers, like the woman over there mentioned, make sure you ask for third-party testing. The FDA cannot regulate the substance, so the purity of the hemp-dried CBD that you may be getting may be overshot or under, and you may be paying basically, for a very small amount that you're supposed to be getting. So third-party testing, they should have that available for consumers, and it's your right as a consumer to ask anywhere you go. Thank you, Allison. By the way, I have the last question here. You were talking about the probiotic, and then that's helping diversify the gut microbiome because there seems to be a link there with MS. What about kefir? We were looking at kefir and cancer, and we were noticing that there are some changes. Kefir is another type, but we found out that it sticks in the gut better because it's there was a mechanism there versus just a pill every day. Have you guys done any research with that or came across that?
Yeah, I haven't. I think it's a great point. I don't know a lot about specifics for what kind of probiotics are best for MS, and I don't think there's really good literature yet with regards to this. But I think kefir's another great option. I think just try to find something that's low in sugar would be the general pearl for me. Yeah, thanks.
Okay, thank you. We want to thank Allison for being here. Thank you very much. Today's sponsors were TG Therapeutics, Biogen, Bristol Myers Squibb, EMD Serono, Horizon, Novartis, Alexion, Genentech, Amneal, and Banner Life Sciences. And again, we want to thank all of them, right? Also, the person who created this whole thing, Mindy. I'm going to say goodbye to you all right? Have a good one. Thank you.